So let's look at a little more to define glomerular filtration rate. So we want to consider about the total glomerulus and the volume of fluid that is filtered across the glomerulus membrane in the kidneys now at a rate. So the total volume of fluid that's filtered across glomerular membrane per unit time, we can define as glomerular filtration rate. And that is, we figured out this filtration rate is proportional to the pressure gradient or pressure drop across glomerular membrane. We define as a delta P sub G. G stands for glomerulus. In fact, inside these pressure drop has two components. One is the simple hydrostatic pressure because the arterial blood has higher pressure than the venous side, and the glomerular Bowman space has a constant low pressure. So that direct pressure gradient will affect the filtration. But at the same time, because of this size differences and concentration differences between these inside blood and the Bowman space or urine, and there comes an osmotic pressure as well. And the proportionality constant we call ultrafiltration coefficient, because you see that ultrafiltrate composed of this fenestrated glomerular capillary and outside interdigitating podocytes. So for example, about general 70 kilogram person who have known about glomerular filtration rate of 125 milliliter per minute. So this corresponds to renal plasma flow. We already discussed about 600 milliliter per minute. And what does this glomerular filtration rate tells us? So we are curious about per day, how much of filtration happens through our kidney, especially glomerulus. So 0.125 liter per minute multiplied by a day, 24 hours and 60 minutes per day, meaning that every day 180 liter, which is a huge amount, almost 200 liter of the water is passing through the glomerulus, which, you know, if I leave it there, almost this huge amount is passing through. However, in the end, we only about having about 1 to 1.5 liters of urine is coming out or through the ureter and the bladder. So what's happening? What about the remaining, most of this water? It has to be reabsorbed. So assuming high, here we can see high renal flow, which is necessary and important for the filtration function of the kidney, almost 1 liter per minute. And that's, you know, about significant portion of our cardiac output. So now we can think of a balancing function of the kidney in the body. So kidney not only just filter, it regulates the excretion of sodium chloride and water. We already saw that by reabsorption of substances. The kidneys preserve extracellular fluid volume. So extracellular fluid, the fluid volume in our body, a big chunk of the volume is inside a cell called intracellular fluid, but another big chunk will be outside in the interstitium and also inside in a blood plasma. So kidney preserves this volume and extracellular fluid. Thus, the plasma blood volume, kidney is controlling that. And eventually what that means is, you know, the volume of blood plasma determines blood pressure. And blood pressure is very important because the pressure eventually is the driving force for the blood flow, which perfuses oxygen and nutrients to our cells, which we are necessary. So kidney, if kidney is malfunctioning, which will be a very big problem, and a patient can die with a very short amount of time. So kidney is really important in that, making this proper balance in our body. So reabsorption is defined as transport of molecules from the fluid. Okay, let me explain here first. It makes it easier. Afferent arterial blood gets in, and the glomerular capillary filters out as a filtered part, and the rest coming out as efferent arterial. And through this tubule, we reclaim those important ones, such as water and many vital chemicals we reabsorb. And then what's unnecessary will secrete back to the urine, which is excreted. So reabsorption is defined as transport of molecules from the fluid inside the tubule. So this is the tubule to our blood. And secretion is the opposite. So transport of molecules from the blood to the tubular fluid. So now let's see the sequence of the fluid from this Bowman's space and to the eventual ureter and our bladder is Bowman's space to this proximal tubule and loop of Henle and distal tubule and eventually collecting duct. I won't touch on too much detail in this time, but those who are interested, you can actually take a look more of physiology book. Here, I just want to emphasize that sodium, so important, sodium recovery by reabsorption. Let's see about sodium. 67% is reabsorbed in proximal tubule, 25% is reabsorbed in loop of Henle, 5% in distal tubule, and even collecting the 3% is reabsorbed, recovered. Look at this. This adds up to 100, almost 100% of sodium recovered. So let's summarize. Excretion of molecules by liver and kidney and biotransformation of compounds in the liver are responsible for eliminating waste, toxins, and maintaining our homeostasis. Especially biotransformation is occurring within the liver, especially hepatocytes, and that's the primary functional cells of the liver. And our kidney receives almost 20% to 25% of cardiac output. With this high flow rate of plasma, is feeding over 1 million of nephrons, which are organized collection of tubules and blood vessels and interstitial spaces. And these nephrons do a critical function by filtration to create ultrafiltrate of plasma, which is following process during flow through the tubules to reabsorb our vital compounds and secrete unnecessary compounds. Thank you for your attention.